It's now my pleasure to introduce our first speaker, Secretary Lanier Cansler, new Secretary of the North Carolina Department of Health and Human Services and a member of Governor Beverly Perdue's cabinet. An accountant and medical company owner, he served in the State House of Representatives for 4 terms before becoming Deputy Secretary of Health and Human Services under Governor Mike Easley. Since leaving HHS, he established the consulting firm of Cansler Fuqua Consulting. Secretary Cansler has also served on the board of the North Carolina Partnership for Children for the past year. In January 2009, Governor Perdue asked him to return to HHS as secretary. Please welcome Lanier Cansler.
Thank you very much. It's a pleasure to be here this morning, and I want to welcome all of you to what I think is going to be a very exciting and interesting conference. We're always looking for ideas to make North Carolina better and ideas to advance our state. And preparing North Carolina for a prosperous future through advancing our investment in young children is truly a important goal that we all will need to work to achieve. Again, welcome to all of you, and look forward to sharing ideas and learning more as the day goes on. The governor has a focus and has an agenda which she desires to push North Carolina forward, creating jobs and building the economy. To do that, she understands fully that we must have both a well-educated as well as a healthy workforce. What we're going to talk about today is starting at the earliest years, childhood years, on how we accomplish that goal. Because from the time we start until the future, building that capability is extremely important. Smart Start helps serve both of those areas, helping to make sure our children have healthy starts and healthy lives, as well as having the base of education in which we can accomplish our goals. Not often do we hear about early childhood education and economics and the economy. I'm a CPA, and quite frankly, when I've worked in the past in business, et cetera, that always wasn't the first thing that came to my mind. But as you start looking at the opportunities and looking at the future and looking at the world global economy and looking at the challenges we face, it becomes very clear that we have to start very early to make sure that we have the right healthy start and the educational start to prepare our children to become strong adults, and what we do for them through these programs help long into the future and actually impact them the rest of their lives. Investment in our young children is probably one of the best investments we can make, and we must continue to try to achieve that goal of putting that investment there. We're in a tough economic time right now, and a part of what I'm dealing with every day is looking at the budget, looking at the cuts, watching the demand for services continue to rise at Health and Human Services, while at the same time the amount of dollars is becoming less and less. And it seems like, and Secretary Crisco and others will tell you, that just about every time we go into a meeting, it sounds like that our available revenues and dollars continue to look bleak. But we know that now is the time to take advantage and start working for the future, so that in the future we have a stronger economy and hopefully less problems when we have downturns like this in the future. North Carolina has been a national leader in early childhood education. Smart Start's been around since I was in the legislature. I think I went to the legislature in '95, and it was started just a couple years before then. And when I first went in, one of the issues I had with Smart Start was not the program and what it could do, but was accountability. And over the years, we have created great accountability. We can document the success. We can document how the dollars are spent, and we can show that the benefit of the program is there, and nationally it's seen and recognized. And so now we must continue to build on that and find other innovative ways to do more to make sure we accomplish these goals. North Carolina's Smart Start program has been cited as one of the 4 in the country that could be a pathfinder for the nation, a model to follow. And as a result, through the annual conference and others, I think the annual conference last year, I think all but maybe 4 states had representatives at the conference to learn more about what we're doing and the positive impact that we're having. The partnership between the Division of Child Development and the Department of Health and Human Services as a whole, the National Partnership for Children and local Smart Start partnerships have come together to create a force that is helping our children develop socially, emotionally, and providing them with an academic foundation. All of these things are the tools that we need to continue working with, and you being here today and with the fine panel of speakers, hopefully we will identify even more innovative ideas that we may be able to use in moving forward, even in difficult budget times, that we can accomplish these goals and continue to keep our focus on the future and what great benefit this is going to have. A recent North Carolina Legislative Study Commission report said, "It is critical to ensure the healthy development of children in the state and improve outcomes for all children in order to ensure the future success of our state and our citizens." With that legislative support and that legislative belief and dedication to this effort, I'm sure we're going to be able to succeed. So what we're here about today is high-quality child care because it's vital to our current workforce productivity and invest in the future workforce. Having that child care so parents can work and feel comfortable their children are being well cared for while they're at work, while also providing them educational basis and teaching them about healthy nutrition, those kind of things is key to a successful workforce now, but even more key to the future.